Hi there. Today we're going to talk about controlled breathing. So some of our objectives today, we're going to actually talk about why and how we need controlled breathing. We're going to describe and talk about the challenges that happen for things that make us short of breath and why that whole thing happens. And then we're going to review how to do pursed lip breathing and diaphragmatic breathing. Okay, so breathing retraining. So why do we need to learn this? Because when our shortness of breath starts to get to be more significant. So if we go for a bike ride or we go for a walk or we go hiking, we expect those things to make us become short of breath. But when everyday stuff, we start noticing shortness of breath with everyday stuff. And in this particular slide, we have ADLs and IADLs. ADLs are just the everyday stuff, taking a shower, cleaning, getting up around the house, getting dressed, maybe just getting out of bed and eating and preparing food. Those are our daily activities. And when we start noticing that shortness of breath starts affecting those daily activities, we're going to see a little pattern that happens in the next couple slides, that these daily things start becoming more difficult. And even independent activities of daily living, like cleaning, going to the grocery store, doing laundry, actually taking care of your medications, sometimes talking on the phone can make us short of breath. And we're going to talk about how we can use pursed lip breathing and diaphragmatic breathing to help us control our breath to do these everyday things, and some other things we can do to help with this stuff. So challenges. So if somebody has COPD, the normal process of breathing is, or with healthy lungs, with breathing is all your organs need oxygen. So the job of your lungs and the function of your lungs is to bring in oxygen. It goes into your blood supply through your lungs, goes into your blood supply and goes to all the organs of the body. And then carbon dioxide is a byproduct, and that comes back. So this thing actually occurs in your lungs, in the smaller part of your lungs. So oxygen goes in, goes to the rest of your body, carbon dioxide comes back, and they actually cross each other in the lungs. They do that all on their own. They know how to do that. Normal, healthy lungs don't need to help that process, but that process is absolutely necessary. So when we talk about some challenges that happen when we get short of breath, we talk about air trapping. So what happens with air trapping? So people who have COPD, their lungs, because of the disease process, makes the airways, it's called alveoli, right down low where that oxygen and carbon dioxide pass each other. The disease process makes it more of a challenge for that passing of gases to happen. So what happens is with lung disease, and especially COPD, we start to trap that bad air in there. That bad air gets kind of stuck in there. It's not able to get pushed out. So when the good air is trying to come in, there's no room for the good air. And we call that air trapping. That bad air is trapped in there, can't get out, which is really important. And the good air, which is really important to get in, can't get in. So we become short of breath because we're not getting air passing the way it should. So we get a little anxious when we get short of breath. And that's very understandable because you can't breathe and now what do I do? And you kind of start to panic. And we're going to talk about how just in these next slides, right next door here on the side, we're going to talk about how that process gets into be a little cycle. And what happens is it can affect you emotionally. And it's kind of frustrating, and it's you get angry and you get sad and you think I can't do anything because everything makes me short of breath. And then that directly impacts our quality of life, because then the everyday stuff is a challenge. There's no room for the fun stuff because we're too short of breath just taking care of our everyday needs. So on the graph on the right of the screen, if you look at the immobility side, this little cycle starts. So the more short of breath we get because of the lung disease, the more our breathing increases, or our demand for breathing increases, because your lungs are working very hard and it's not able to get air where it needs to get to. So your body says you need to breathe faster. Obviously, we need to get more air in there, so it makes you breathe faster. So that increases your breathlessness. So now you get a little more shorter breath. And because you get more shorter breath because you're doing activities, let's say just taking a shower or making a sandwich, you kind of stop doing less. And when you do less, your muscles get very deconditioned, because your muscles like to move. They in order for them to be healthy and strong, they need to move. You need to move those muscles. But it's too hard to do that because you're short of breath. And then because you're so short of breath, your body says, okay, we need to breathe faster again. And this little cycle just keeps going. You breathe a little faster, you become more short of breath. It's harder to do things. Your muscles get deconditioned, and this cycle just keeps going. So on the other side where it says pulmonary rehab, our goal is to kind of reverse that cycle, to actually break that cycle from going. So we ask you to exercise along with other things we do in pulmonary rehab. But and in that process of starting to exercise, we need to teach you how to control your breathing a little bit more. So we're asking you to do a little bit of exercise, because those muscles need to be exercised, and when they get more conditioned, they don't need as much oxygen. So guess what? If they don't need as much oxygen, you become less short of breath. You become less short of breath because you're more conditioned. Your body says, hey, I don't need to breathe so fast when I'm doing making a sandwich, because my muscles aren't demanding it. So I can slow down the need, which means you become less short of breath, because now your body's not telling you to breathe more. And that's all because you're exercising more. So now if you can start moving your muscles more, you build up more strength and you can do more. And the more your muscles get strong, the less short of breath you are, the less you have to breathe and feel that shortness of breath. And then that cycle starts going the other way. So that's the goal of pulmonary rehab, to help show you how to do that. So I really like the bottom picture. We're going to talk about that briefly. The bottom picture is the gentleman saying, he gets short of breath. This is exactly what happens. You start shallow breathing because you're breathing faster. Your brain is saying you need to breathe faster because you need to get that oxygen in. And those organs need oxygen, so you start breathing faster. Well, what happens is when you start getting anxious, you get all tense and you start using other muscles, which we're going to talk about on another slide. You get all tense here and you start using these accessory muscles. And then they're tense, and then you get more short of breath. And then because you get more short of breath, to do activities is harder, and you get more anxious. And again, you see where that cycle continues. So how do we change that? Pursed lip breathing, absolutely huge. Everybody can do pursed lip breathing. And in pulmonary rehab, we're actually going to show you how to do pursed lip breathing for you. The concept is exactly the same. So we're going to talk about how you do, we're going to practice it first, how you do pursed lip breathing, so you understand why we want you to breathe a certain way, why we're asking you to exhale and inhale and relax shoulders, because then when you start using it for yourself, you're going to still do pursed lip breathing, but you're going to get it to work the way you need it to work. So the whole point of pursed lip breathing is it allows you to exhale better. Remember a few slides back where I said you can trap air in there? Well, this technique allows you to exhale more. That's the problem. We just got to get the bad air out. If we can get the bad air out, the good air gets in. So how do we do that? So it helps get the trapped air out. So how do we do that? We exhale, we blow out, and we relax our shoulders. We're going to relax our neck and our shoulders. And then now I'm going to show you how to do some tips on pursed lip breathing. So the top slide says inhale. Now remember, we're practicing this, okay? So you're not going to practice this when you just get done taking the garbage cans out, because you're going to be too short of breath and anxious and panic. Now is not the time to practice it. We want to practice it when we're not short of breath. So practicing it, everybody, whether you've got sinus issues, it's hard to breathe through your nose, when you are at rest and not putting demand on your body, we can breathe through our nose. The job of our nose is to clean the air, filter the air, and make the air a certain temperature before it gets into our lungs, because our lungs require it to be a certain temperature, a certain moisture when it gets down there. And then we'll touch on in class more why humidity is a factor and smog is a factor or a fire is a factor. It starts affecting your breathing, but in class we'll talk about that more. For now, we're just going to focus on how you do the technique. So when we practice, we're going to breathe in our nose, and it's just a slow breath in. You'll read, smell the roses, blow out the candles. Okay, we're going to change the blow out the candles a little bit. So it's just a breath in. So maybe you count to 2. I'm inhaling 2 because you want that nose to do its job to clean the air, filter it, and make it a certain temperature. Now, when we exhale, if you hear blow out the candles, blowing out the candles is fine. It's showing you how you use your mouth and pursed lips. But I want you to kind of think of blowing bubbles, because sometimes when we blow candles, we're blowing quickly. And this should be a very passive, slow, if you can, exhale. So like if you blow a bubble, we just blow a bubble, like that lady in the bottom is blowing a bubble. And that's the motion of your mouth. It's very slow. It's a very closed lips. And then when our smaller lips, it's a pucker. Pucker through your lips and exhale slowly and gently through those pursed lips for at least twice as long as you inhale. So why do I have to go twice as long as I inhale? Well, for people who have lung disease and COPD, you want to allow that bad air to get out. Well, now the good thing is just because you're exhaling doesn't mean that oxygen comes out with it. Because remember what I said in the beginning, the oxygen knows where to go and the carbon dioxide knows where to go. So what you're doing is you're helping the carbon dioxide part. The oxygen will worry about itself. So by causing a puckered lips or a puckered mouth, you're causing a back pressure in your lungs. So this back pressure in your lungs kind of, in a sense, keeps your airways open a little bit more. They don't close, but they open a little bit longer. So there's plenty of room in there for that bad air to go where it needs to go to, and that good air to get where it needs to. So what you're doing is you're pretending your lungs are healthy lungs again, where this used to happen all by itself. By you just doing pursed lip breathing, you're allowing that process to happen. And if you do it quick enough, it only takes a handful of breaths. So we're gonna see what that looks like. So when we practice it, we're gonna sit nice and tall. We're gonna be relaxed. We're gonna roll our shoulders if we have to, because this gets very tense. We're gonna roll our shoulders, relax. We're gonna inhale for the count of 2, and we're gonna exhale for the count of 4. And if you're relaxed, it shouldn't be that hard to go to the count of 4. The point is just to exhale a little bit longer. Okay, and then in class, we're going to show you little tricks on how to remember, roll those shoulders, relax those shoulders, because when we start to panic, we get all tight, and then we can't breathe like we're supposed to breathe. So we relax our shoulders and exhale through those lips. So relax our shoulders, take a breath in, exhale, and see my face? It's very relaxed. Exhale. Okay, so practice it first. Practice while you're watching TV, practice before you get out of bed. And then when we're in class, we're going to start talking about how you implement that pursed lip breathing when you're starting to get short of breath and how you modify it with exercise. But that's the basics. You have to know the basics and you have to practice it. And pretty soon it gets to be easier. So now let's talk about diaphragmatic breathing. So just as important as with your lips exhaling, our diaphragm, healthy lungs when we're younger, your diaphragm is the muscle that's right under your lungs. And we'll just read the diaphragm is the muscle under your lungs that helps you breathe. That is the job of your diaphragm. Your diaphragm sits right underneath your lungs, like you can see in the picture there. And there's the green arrow. That diaphragm is supposed to go up and down with breath. Now, what people don't maybe understand is sometimes when we breathe, we think that we breathe like this, when actually what happens is your lungs go down when they breathe. So that diaphragm pulls your lungs down. Inhale and then exhale. So it actually, people think they breathe like this, so they want to suck their tummy in. No, your lungs are supposed to go down. So that diaphragm, that's what it's supposed to do. It's supposed to pull your lungs down. That's the only job it has, is to pull your lungs down. But when we get lung disease and we get short of breath, we end up using these extra muscles and pulling our lungs up, which makes us more short of breath too. So, and the next point says many individuals use accessory muscles to help breathe. This takes additional effort and may increase your shortness of breath. It absolutely does. This is why Philip and I tell you to relax and roll your shoulders, because we don't want you using these muscles. We want you to loosen these muscles so your diaphragm can start working. Okay, so let's focus on your diaphragm. So in the picture, it actually has it, you can lay down. So a lot of people who have lung disease, it's difficult to lay down, but you can lean back in a chair. Okay, you kind of get the idea. The point of laying down is you actually can feel your diaphragm and your tummy move a little bit more. And that's why we ask you to lay down, but that's difficult sometimes. So even if you lean back in a recliner, you can do this. So the point of practicing, so you know how to do diaphragmatic breathing, is one hand goes on your chest and one hand goes on your belly. Okay, because we want to see a visual. So when we take a breath in, if you're short of breath and you're using accessory muscles, you'll see this hand go up and down because we're using these muscles. When really, our you can't see my hand down on my belly. Our hand on our belly should be coming out a little bit. So when we take a breath in, remember our lungs go down. When we take a breath in through our nose, now it just exaggerates there, through our nose, you should see and feel the belly come out a little bit, just a little bit. And then when we exhale and we come out those puckered lips, the belly goes back down or it relaxes. So sit or lie on your back, inhale through your nose. So we'll just practice the inhale through our nose first and exhale through our pursed lips to the count of 4. And what happens with our hands, and if we're doing it right and using our diaphragm, our hand on our belly comes out when we inhale, and then it relaxes when we exhale. So how do we get to do this? Because if we're used to using our shoulders, how do we work on our diaphragm doing its job? How we do that is little steps, okay? So when we're just at rest right now, we're gonna keep our hand on our chest, and we're gonna keep our hand on our belly, just like the picture is showing. And we're gonna practice it. So first of all, when we're gonna breathe in through our nose, we're gonna feel the air in our chest. That's okay, because we're used to doing that. And we're gonna exhale. And so we got our personal breathing now. So now when we take a breath, I want you to picture putting your air closer down to your side here a little bit more, maybe just under your arm. Okay, so that's where we're going to focus putting our air. So when we take our breath in, we're going to focus, okay, I'm going to push my thumb out a little bit or feel my thumb move, and exhale. I'm going to do that again. Inhale, exhale. So now I move the air down to my chest, and it takes a little practice, but you can put the air wherever you want. You just have to retrain yourself. That's where practice comes in. So now if I start getting good, now I'm going to go down to my rib cage. So now my thumb is sliding down my rib cage. And I'm going to take a breath in through my nose, and I'm feeling my thumb come out, and I'm going to exhale. And you actually start, when you start practicing that, you actually retrain yourself to see and feel what it's like to use all of your lungs, because your lungs are in there. They've just gotten a little lazy, that's all. So we got to practice making our diaphragm work a little bit more again and taking that deeper breath. When you hear deep breathing, that's what they're doing. They're taking deep breaths using all of your lungs. So to recap a little bit here, because I think that's my last slide. To recap, it is. I want you to practice the pursed lip breathing first, in your nose and out your mouth. When you're at rest, don't worry about this with exercise yet. In your nose and out your mouth. And it's just a relaxing breath. After a while, you may find that you don't inhale for the count of 2, and exhale for the count of 4. You may inhale for the count of 1 and exhale for the count of 3, because that's how your breathing pattern is. The point is that you exhale twice as long or a little bit longer than you inhale. That's the point. And as you start practicing with the breathing, just sit there, relax, and picture yourself, put your hand on your chest so you can see if you're using these muscles, and take breaths and try to push it down your lungs. And eventually you can take this deep breath and you're using all of your lungs. So if you practice this and you get to see what that feels like, when you're in pulmonary rehab, that's exactly what we work on. We work on you relaxing your shoulders, exhaling, and moving that air down. And I promise you, once you get this down, and it takes a little practice, you will do it. It'll maybe take you 10 breaths to finally get your breath under control. And 10 breaths is actually 1 minute of breathing. So when you're starting to panic and get anxious and you start feeling that, ooh, I'm starting to get short of breath here, you already know how to do pursed breathing. You already know how to relax your shoulders and use your diaphragm, and you stop and you pay attention to that stuff, your breath will very quickly return. And that is why we call it controlled breathing, because you have control of it. So if you have any questions, let us know, and we will talk more about this when you're in pulmonary rehab. If you have any questions, write them down. And when you see us in person, you can remember what you wanted to ask us. Alrighty, that is it for controlled breathing.